First, you're going to need to gather your equipment, which is the blood gas kit. It's going to have sterile gauze, a biohazard bag, alcohol swab, point lock device, a syringe with a needle, and labels. Then you're going to verify your order, the ABG order. You're going to check the chart to see if they've had any changes in FiO2 or vent changes. If so, you're going to have to wait 10 minutes or 25 if they have an air-trapping lung disease. You're going to look for a history of wrist trauma. You're going to check their coagulopathy by checking their PT, PTT, INR, and platelet count. And you're going to check their drug list to see if they're on any anticoagulants. Then you're going to wash your hands and don non-sterile gloves. You're going to introduce yourself to your patient. Hello, my name is Alyssa. I'm a respiratory therapy student. Inform them of the procedure, so I'll be taking some blood from you today. And then you're going to need to confirm the patient by asking them their name and date of birth. Then you're going to palpate both radial arteries to find the puncture site. If they're both about the same, then you'll use the non-dominant hand, and you're going to perform a modified Allen's test on them. After that, you're going to scrub down the puncture site with an alcohol swab. You're going to aspirate 1 milliliter of air into the syringe, and you're going to open sterile gauze and place it on the patient's elbow. Then you're going to continuously palpate the radial artery. Do like for hard squeezes. All right. I got it. You're going to position the needle parallel to the artery. Position the needle parallel to the artery at a 45 to 60 degree angle, going against blood flow, and immediately inform them before you puncture them. You're going to slowly insert the needle until you see the do you want to keep pumping it? Until you see the flush of blood, which we had. And then you're going to slowly take out, there we go, the needle. And you're going to grab the sterile gauze and apply pressure to the site for 5 minutes. Then after 5 minutes have passed, you're going to discard the needle, so put it in there and put it in the sharps box. It's in the sharps box. You're going to cap the sample and tab it to get rid of the air bubbles. Next, you're going to rock and roll the syringe, like so, to make sure that the heparin is evenly distributed. After you do that, you're going to label the sample, put it in the biohazard bag. You're going to conclude the procedure by asking your patient if they're comfortable, making sure they have the call light, and then once you leave the room, you'll analyze the sample and then document the procedure.